Hi, Megan. How are you today?
I'm doing good. How are you?
Pretty well. Thanks for asking. So, listen, before we jump into our session and we pick up where we left off last week, we do need to finish up some paperwork. And today, unfortunately, this is a little bit more uncomfortable conversation, but it's really important for me to understand like where you are and what your baseline is to see where we can go forward. Um, it might seem a little invasive. That's what a lot of patients tell me. However, or clients, I mean, but I want to remind you that all information never goes out. It only goes up. So whatever you say to me, like it's between you and I, unless there is a risk of danger to yourself or others. Does that sound okay? Do you feel
Yeah,
like you're ready?
yeah.
Perfect. All right. So basically today what we're going to be talking about is a lot of kind of checking where you are. So, just off the bat, in the past week, have you? Oh, actually, let me explain this first before I really get into it. I have my chart right up on my screen. So, if I'm not looking directly at you, it's because I'm looking at that. I just really want to be transparent before we get into it. But I am fully listening, ears turned on. So, in the past week, have you attempted suicide at all or
No,
had any self-injury behavior?
no,
Nope. Okay. And then have you had any suicidal ideation so within the past week?
not within the past week, no.
Okay, perfect. Not perfect. I mean, okay, that's good. Uh, and then have you had any recent loss or other significant events come up recently?
Um, no,
Okay. And then, is there any pending incarceration or homelessness?
no,
And then for you, have you had any current like feelings of isolation or feeling alone?
no,
Okay. And then for treatment history, have you had any psychiatric diagnosis or treatments?
no.
Okay. And then let me go up here now. Okay. I'm just going to ask you a few questions. So, within the past week or recently, have you felt any sense of hopelessness?
Um, no.
Okay. You kind of hesitated. Do you want to elaborate on that, or were you kind of just like,
Oh,
thinking about it?
just a little stressed out with things, but I don't think it was to the extent of hopelessness.
Okay. Yeah, I love that you're able to check in with yourself. How about helplessness?
No.
Okay. Any feelings of being trapped?
Um, Not so much anymore, but at times I have felt trapped.
Okay. When you say at times, when do you think was the last time you felt that way?
Probably prior to starting my master's program, I felt pretty trapped in my career and my life.
Okay. How do you feel now that you have been in your master's program?
I am feeling a lot better because my life is going on a trajectory that I'm much more happier with.
That's awesome. Thank you so much for sharing that. That's really great to hear. Back to heavy questions. Do you have you experienced any major depressive episodes?
Um, Not recently, but I have.
Okay. When was the last time you had one?
After I had my daughter, I had a pretty traumatic birth, so I had a lot of like PTSD and some depression and like I guess more anxiety than depression, but had a lot of like a really hard time with all of that.
Yeah, that's understandable, especially after a traumatic birth. Um, and those emotions and feelings that can linger afterwards. Mhm. How about, so on the other hand, has there been any mixed affective episode?
No.
And then how about command hallucinations to hurt self?
No,
Have you been experiencing any highly impulsive behavior?
no.
And then what about any sort of substance abuse or dependence?
In the past I have, but not, it's been years.
Oh, okay, years, yeah.
Just like drinking. And that's much more under control probably in the last 7 years.
Okay. So you're on the up and up. Um, you did mention before that you had a traumatic birth and traumatic birth? Yeah. And that you had a lot of anxiety come from that. Are you still experiencing severe anxiety? Do you have any anxiety maybe separate from that?
I went to counseling a lot after my daughter's birth, and I had my son almost about a year and a half ago, and that actually really helped, just like heal my mind because I had a much different experience.
Oh,
Um, when I gave birth to my daughter, I almost died and she almost died, and it was just a very traumatic thing. So yeah.
yeah. That sounds really hard. And I'm glad that you went and got the resources you needed to help you through that time. I'm also really glad that you were able to rewrite the story a little bit with your son's birth.
Yeah, it made a really big difference in my life, just having a normal experience.
Yeah, of course. I am sure that it was very healing in many ways than one. Just for time, we're gonna jump back into this, but do you feel like you might be a burden onto family or others?
No.
Okay. And then do you have any chronic physical pain or acute medical problems?
I do have some medical problems, but I am working through them. I had surgery back in December. Wasn't as successful as what I would like. Um, I saw a specialist earlier this month, and I see another specialist in August. We'll see kind of like how things are going.
Okay. So it sounds like you are working with a care team. Awesome. Have you experienced any sort of homicidal ideation? All right. Aggressive behavior towards others?
No.
And then do you have anything available to you for as a method for suicide?
I mean, I own several guns, but I would not, I wouldn't use them. I don't feel the need to.
Okay. And then do you refuse or feel unable to agree to a safety plan?
Oh no, I would be, if I were feeling suicidal or anything, I would definitely like be seeking help.
Yeah, it sounds like that, especially after like just going back to your first birth, like you went and sought additional resources to help you. And then have you ever experienced any sort of sexual abuse within your lifetime?
Yes, a long time ago.
Okay. Would you like to speak a little bit more to that? You don't need to.
No, I don't really want to,
Okay.
but I feel like I've dealt with it. I feel in a good place with it.
Yeah. And if it comes up in counseling, we can tackle it or navigate through it. Fully understand. Has there been any family history of suicide?
No, I do not believe so, but I don't know my mom's side very well. My grandmother was adopted, so that's kind of a missing link.
Oh, okay, really good to know. All right, we have a little bit left and then we can move on. So, do you do you have any, that's not how I want to word that. Are you able to identify any reasons for living?
Oh yeah, I definitely my children and the work I do every day. I help a lot of people, and that gives me a reason to get up in the morning.
Mm, awesome. And then do you feel like you have a supportive social network or family as well?
Um, my husband is very supportive, but I don't really have a very supportive family. But I do know, like, I have my husband and I have some really good friends.
Okay, so it sounds like you have a really supportive chosen family. Cool. All right. And then do you have a fear of death or dying due to pain and suffering?
Um, I'm not scared of death because I'm very strong in my faith, but I do, it's been a while, like especially like from counseling, but after my daughter's birth, I had a lot of like PTSD and like flashbacks of like the pain I was in and close to death, and that was kind of scary for a long time. But I feel like I've kind of worked through it at this point in my life, um, that I don't have the fear I once did.
That makes sense. Um, and then what's your belief on suicide? Do you believe that it is immoral?
Um, it's not something would do, and it's not a way I would want to go. But as far as morally, I think it just makes me sad that someone has gotten to that point that they chose that as an option, and I didn't feel like they had a way out.
Okay. Thank you for sharing. All right, Megan, just looking at everything that we talked about today and just the answers you have given me, I don't feel like it's necessary to move forward with this assessment. You do not seem like you are a danger to yourself or others at this time. And yeah, all right, we can get on with our session now. So,